I'm Josh Ryan. I'm Sophie Ryan's father.
My name is Tracy Ryan. I am Sophie Ryan's mom. My daughter was diagnosed on June 23rd, 2013 with an optic pathway glioma brain tumor, and we have been using cannabis oil along with Western medicine to completely destroy her tumor.
I mean, really, Tracy's pregnancy couldn't have been more perfect.
And it was the most incredible, incredible feeling when I saw those double lines on that pregnancy test. I felt like I was exactly where I needed to be at exactly the perfect time, and all of my dreams were really kind of coming true and unfolding right in front of my eyes.
And when Sophie came out, it was the most amazing moment of our lives. I mean, if you're not a parent, there's nothing like it when your child comes out and you hold your child for the first time.
She was perfect. She was beautiful and healthy and chubby and just gorgeous. And we had a great life. Things were going our way.
Sophie was happy and healthy and beautiful, and we really had the picture perfect life. And then at 8.5 months, we started noticing a twitch in her eye. It was called a nystagmus. And when it took her in to take her to a doctor to have it looked at, he wasn't sure what it was.
Our pediatrician was like, "Hi, Ms. Ryan. I wanted to give you a call because we got Sophie's MRI results," and my heart kind of like stopped, kind of like it's doing right now. And he was like, "What I'm about to tell you is going to be very hard for your family." He was like, "Something was on Sophie's MRI." And when he said that, I felt like my world just kind of collapsed inward on me. And I was like, "What do you mean?" He was like, "Well, unfortunately, your daughter has a brain tumor, and it's called an optic pathway glioma." And he was like, "These are very, very rare." And I was like, "A brain tumor? What do you mean my child has a brain tumor?" And it was hard. It was one of those moments that, like, every time you relive it, you just kind of can't help but cry because it was so emotional and awful. And I'll never forget asking the doctor, "Is my daughter gonna die?" Because here I am looking at this like perfectly healthy little child, and all I can think about is what I know about brain cancer, which at the time was very, very little, and it's deadly from everything that I knew. And he goes, "No," he goes, "the kind that she has is very slow growing. It's not malignant, it's benign." And I was like, "Well, what do we do to get rid of it?" And he goes, "Well, you can't get rid of it. It's not the kind of tumor that goes away, but you're gonna wanna do chemotherapy because she's too young for radiation." And I was like, chemotherapy? She's 8.5 months old. I can't give my child chemotherapy. She's a baby, like she's not even like crawling hardly. And he was like, "Well, I'm gonna set up an appointment for you to meet with the oncologist tomorrow. And they can go over your options, but really your only option right now is chemo."
Starting chemo on her, at that time she was a year old, and that was really hard. And also we had to do brain surgery we had to do a biopsy to take a piece of the tumor for them to test and see if it was high grade or low grade. Tracy got a phone call from one of our oncologists saying that it had hit a growth spurt, and it was really not an easy conversation to take because he basically said that the tumor is showing characteristics of a high-grade tumor, and we still are hopeful that it's low grade and it's just hit an uncharacteristic growth spurt. But if it is high grade, there's a good chance she won't live to see her second birthday.
I was contacted by one of the mommies in my mommy group named Vanessa. She had shared one of the posts that I had put up about Sophie, or had shared her page. And one of the women that was in the film, The Business of Being Born, Anna Palo, who was a doula in the movie, ended up contacting my friend Vanessa because they knew each other, and told her that Ricky Lake and Abby Epstein were doing a documentary on how cannabis oil kills cancer in pediatric patients, nonetheless. I started communicating with Abby, and she started sending me all this information about cannabis oil and these medical documents and these YouTube videos, and we'd already heard about it from one of my husband's friends that are all overseas. And we just thought, that it all sounded so crazy. We're like, you know, we would never give our child marijuana. That's a drug. That's like saying, okay, I'm gonna let my kid drink a beer. Why would we give our kid pot? And we brushed off all of these messages that all these people had sent us. We literally researched everything but cannabis. And we couldn't find one negative thing about using medical marijuana for cancer. Everything else that we researched, there was always negatives. Well, it can do this, and you can have this side effect, and it can cause this later in life, and you know, there's the possibility of these things happen with cannabis. Like, we literally couldn't find anything bad about it.
I'll never forget that call that we got. We were at home and I think we just finished giving Sophie a bath, and the doctor said that, I mean, you could tell how happy he was, and the joy in his voice, how happy he was to tell us the good news that there was dramatic shrinkage. Not just a little bit, but noticeable shrinkage. And we just kept getting good news on these scans. And it just kept telling us that what we were doing is working, and we were moving in the right direction.
Sophie just completed chemo on November 20th, 2014. The tumor is now almost completely gone. There's a little bit of remnants left. What our doctors have seen and what they have studied is that, you know, what we've seen just isn't possible with chemotherapy. Yeah. Our doctor at one point said that if we saw more than 50% shrinkage, that they wouldn't be able to credit the chemo with that type of shrinkage. We've seen probably 80 to 85% shrinkage, if not more, in this tumor. I mean, there's literally hardly anything left.
Along with our doctors, we honestly believe that they both played a large part. The cannabis oil and the chemo. You know, the two are known to work together very, very well. Each of them work together. Chemo helps a little bit, cannabis oil helps a little bit, but together. It makes a dramatic difference. And we honestly believe the two together is why we've had this huge, huge success.